Let's review the basics of corticosteroid medications. Just a disclaimer, this content is for educational purposes only and is not intended to replace personalized medical advice. Please consult a healthcare professional if you have personal medical concerns. Corticosteroids are non-polar molecules that induce anti-inflammatory effects. They achieve this by diffusing across the cell membrane and bind intracellular receptors called glucocorticoid receptors, forming a receptor-substrate complex. From there, the newly formed complex acts as a transcription factor, which regulates the expression of genes. In the case of their anti-inflammatory properties, corticosteroids have two key effects, both of which stem from genomic influences. In immune cells, corticosteroids participate in both transreppression and transactivation, which refers to the inhibition and activation of genes that encode for certain proteins respectively. Corticosteroids inhibit or downregulate the expression of genes that encode for cytokines. Now, just for a review, cytokines are molecules that serve as chemical messengers between immune cells. So, in the context of using corticosteroids, by suppressing cytokine production, immune cells can't proliferate or mount an inflammatory response. On the other hand, corticosteroids activate or upregulate the expression of genes that encode for proteins that are anti-inflammatory. One commonly known anti-inflammatory protein that's synthesized from corticosteroids is annexin 1, a protein that inhibits phospholipase A2, which is an enzyme that facilitates the synthesis of prostaglandins and leukotrienes, both of which are molecules that are causative of symptoms and inflammation, including swelling, redness, and pain. Another commonly known protein expressed from corticosteroids upon binding the glucocorticoid receptor is NF-κB inhibitor, or IkB. This protein inhibits NF-κB, which is a protein that acts as a transcription factor that induces synthesis of the previously mentioned cytokines, including TNF-alpha, interleukins 1, 6, and 2, all of which I previously described as pro-inflammatory. However, it's also important to be aware of the side effects that corticosteroids can cause. Let's go through the main side effects. Corticosteroids can cause immunosuppression. So this is literally based on the core mechanism of corticosteroids. They suppress the transcription of pro-inflammatory cytokines, reducing immune cell signaling and activation. This ultimately results in a weakened immune response, meaning that the body can't fight off infections efficiently. Corticosteroids can cause the body to become hyperglycemic, which refers to high levels of sugar in the blood. So glucocorticoids can increase liver glucose production and impair insulin signaling in muscle, leading to insulin resistance and elevated blood glucose. Another commonly known side effect of corticosteroids is that they can cause osteoporosis. Now, glucocorticoids or corticosteroids can suppress osteoblast activity and reduce calcium absorption, leading to decreased bone formation through reduced mineralization of bone, increasing the risk of osteoporosis. Lastly, one of the most important side effects of corticosteroids is that it can cause HPA axis suppression. Now, what this means is that in the body, there exists a hormonal regulation system that regulates the release of corticosteroids that are naturally intended to be used for the stress adaptive response. In this system, both endogenous, meaning corticosteroids synthesized by your body, and exogenous corticosteroids, which means that corticosteroids coming from medications, serve as negative feedback signals, meaning that corticosteroids act on glucocorticoid receptors in both the hypothalamic and pituitary glands to suppress the release of corticotropin-releasing hormone and adrenocorticotropic hormone, thus preventing further release of corticosteroids from the adrenal glands, hence the term hypothalamic pituitary adrenal axis, or HPA. And so, because of this, long-term exogenous steroid use can lead to adrenal atrophy, or shrinking of the adrenal cortex, which is where endogenous steroid production occurs. And so, this causes the body to no longer be self-sufficient at producing corticosteroids naturally, in which this event is termed as adrenal insufficiency. Therefore, when you're taking these medications, it's important to make sure that you're taking them at the recommended dose and duration for optimal effect while also avoiding the risk of experiencing side effects. Here are my references. Thanks everyone for watching. If you're interested in more, please subscribe or follow. I would appreciate if you could leave any feedback or criticism on how I can improve these videos, as this is a test run to see how people engage with my content. Looking forward to seeing you guys again soon.